Yes, it is time for our weekly Health Watch segment, and we are joined by our friend of the show, Dr. Hussain of Trinity Health of New England. Good morning.
Morning.
Happy New Year. Good to see you.
You too. Likewise.
All right, so we're still talking about the flu. It's pretty much everywhere now, and I'm sure a lot of you know someone who's affected by this. 45 states, including Connecticut, are still reporting high or very high flu activity right now. What's the reason for this surge?
Yeah, it's been a historic season. Usually we don't see back-to-back seasons of the flu that exhibit so much activity, Symphony, but we did this time around, and it's probably one of the worst flu seasons we've had in decades, probably 25 years or so in the U.S. Not surprising, though, because if you go back a few months, our summertime is wintertime in the southern hemisphere. So if you look at what Australia and South Africa have been through, they've been through a rough season themselves. Australia, in fact, had their worst flu season on record. So it's driven by the same variant that is driving cases worldwide. It's the influenza A variant, H3N2 subclade K, that is predominantly the strain responsible for some of the high flu activity we've seen. However, the silver lining here is that we've seen a little bit of a downward trajectory in terms of flu cases nationwide per recent CDC data. So we may be leveling off, but that doesn't mean that we don't take precautions. And if you haven't rolled up your sleeve, it's not too late to get the flu vaccine, because we've seen in some years there's a peak in January or so, and then a few weeks later the cases start going back up again, and there's a second peak. Yeah. So it's really important to keep that in mind.
Okay, what would you say to folks who are watching and they might say, I've heard that this new strain, it's not even included in the protection and the vaccine. So what would you say to those folks who are still hesitant?
I'm glad you asked that, because there was some initial hesitancy about whether the vaccine is a good match for this strain, but new data shows that it actually might be, the vaccine may be holding up well against this particular flu strain. So there is antibody production that will fight this virus. So if you haven't gotten the flu shot yet, it's not too late. Get the flu shot, especially if you have underlying medical problems above the age of 60, in a vulnerable condition, or you live in a place where you have family members or loved ones with underlying medical conditions. Get the flu shot. Remember, if you look at data across the country, there's about 130 million Americans that have gotten the flu vaccine, which is a little under 40%. So it's a pretty low vaccination rate.
Okay. And how are the hospitals here in Connecticut preparing, or making changes rather, to accommodate for this surge of cases right now?
So if there's one thing we learned as a healthcare industry from the COVID-19 pandemic, is how to deal with these surges. We've seen multiple waves during the public health emergency, so we're well prepared in healthcare across the state to be able to take care of both flu, COVID-19, respiratory illness, as well as the emergent and elective cases that patients seek medical attention for.
And unfortunately, the flu is not the only virus,
Correct.
respiratory virus going around right now. So what's the bottom line for folks to make sure they are taking the best care of themselves and not contributing to the spread of any of these viruses right now in this season?
Get vaccinated. Number two, it's not a bad idea to wear a mask. We've seen it, tried and tested, especially if you're in a crowded situation, indoor situation, poor ventilation. Wearing a mask is always great. Wash your hands. Can't emphasize how important that. It's the basics. Wash your hands with soap and water at least for 20 seconds or more. And then if you're sick, stay home. Wear a mask. Protect yourself. Protect others around you so you prevent the spread of germs.
Yes, and I think there's even a little tune you can kind of sing to yourself as you're washing your hands, so you make sure that you're washing it for the allotted
duration.
Was it 15 seconds?
Do whatever you need to do, but yes, please make sure you wash your hands. And don't use your coworkers' phones or computers. Make sure you use sanitized surfaces. So all of those things will help.
Okay, so if you hear someone coughing or sniffling in the office, say, I love you, but we got to keep a safe distance. Let me get that Lysol can and just
That's right.
take care of our area. All right, thank you so much for joining us this morning.
Thanks for having me.
And we have more